Bay Bridge Health Network is a premier integrated delivery network comprising of 5 hospitals, 20 physician practices, 5 long-term care facilities, 2 urgent care medical malls, and an insurance plan covering over 3 million people in the San Francisco area. As a part of the network's commitment to excellence, implementing an EHR system will reduce operational costs by 10%, expand market share, and elevate patient care. The implementation will include documentation enhancement, clinical provider order entry, and clinical decision support systems. An article from Health Problems of Civilization states continuous use of EHRs is associated with reduction in costs and an improvement in work effectiveness and better patient outcomes. Throughout this presentation, we will discuss the project timeline, critical milestones, estimated cost, and strategic resources needed to successfully implement a multi-hospital EHR system. This high-level project timeline will serve as a roadmap to ensure successful implementation at all Bay Bridge Health Network facilities. An article from Curious states, using a proper implementation strategy for a new EHR system can facilitate success, minimize delays, and increase healthcare workers' satisfaction and decrease the chances of usability being compromised. The initiation phase is months 1 to 4. It includes a thorough needs assessment, identification of stakeholders, creation of detailed project plan and project charter, and evaluation and selection of EHR vendor. Next, the pilot implementation will begin for months 5 to 7. The existing infrastructure will be assessed and upgraded as needed, and data migration and configuration will be done to ensure the facility's needs are met. After this is completed, the EHR system will be implemented in one facility, feedback will be gathered, and adjustments will be made as needed before the full-scale rollout. Following successful pilot implementation, the full-scale implementation phase will begin. This will include network-wide employee training and the implementation of the new EHR system among all Bay Bridge Health Network facilities. This will take place from month 8 to 12. After the implementation, there will be continuous monitoring to evaluate performance and collect feedback from staff and users. Updates will be made to the system as needed in the future. 5 critical milestones that must be achieved promptly to ensure the success of the project will include approval of detailed project plan in month 2, vendor contract completion in month 4, infrastructure readiness in month 5, the pilot rollout month 7, and the entire network implementation at month 8. Capital costs include vendor services, implementation salaries, software, hardware, and network costs. Vendor services include software licensing, customization, and integration. Implementation salaries involve allocating training services necessary to teach users and project management teams how to use the system. Hardware and network costs include upgrades to the hardware and infrastructure, as well as any other equipment required to support the new system's functionality. Ongoing operating costs include maintenance, updates, and technical support for the software and hardware, continuous staff training throughout the implementation and beyond, and governance to provide continuous improvement initiatives and enhancements. Attached is the IT Performa table for review. It provides a breakdown of the capital and operating costs for implementing the EHR system. In the first year, we have capital costs totaling $20.775 million and operating costs totaling $22.5 million. The total cost for the first year is $38.525 million. Throughout the implementation process, paying particular attention to managing and allocating resources is vital to the project's success. The cost and budget must be regularly reviewed throughout the entire process. Resources will be allocated for cost monitoring and control. It is also vital to ensure efficient time management throughout the implementation process. Project management tools such as Asana, Trello, Microsoft Project will be used, and regular status meetings will be constructed to ensure the timeliness of the project. Resources will be allocated to create comprehensive staff training programs to ensure all users are knowledgeable and comfortable with the new system. Support and help personnel will also be appointed to assist with any staff issues. Staff readiness plays a crucial role in the success of the project. Again, project management systems will be used to track and monitor progress, and project managers will oversee milestones. According to the clinical teacher, the project manager keeps each piece of work on track, removes roadblocks, solves problems, and keeps the team motivated. A governance will be established to enforce continuous improvement, and regular feedback will be taken to adjust as needed. Through meticulously planned, timely, carefully estimated project costs, and thoughtfully crafted strategic resources, Bay Bridge Health Network can elevate healthcare standards, create efficient and sustainable processes, and improve patient care. The implementation aligns with Bay Bridge Health Network's strategic goals to reduce operational costs by 10%, expand market share through visualization strategies, and enhance healthcare delivery, which will contribute to the success of the network. Thank you all for taking the time to be here today. If you have any questions, you can contact me at the email listed. And then here are the references included.